That is fantastic. Hot flashes. Do we all suffer from them? Yes. Men and women both. Everything. And men suffer on the other end of it. How you doing, Dr. Brightman? That is fantastic.
I'm well, thank you. How are you?
That's probably the most interesting. Do we all Dr. Rebecca Brightman is with us, but that's probably an interesting way of introducing you, isn't it?
In terms of men suffering as well?
Yes.
Yes, they do. They definitely do, because
both. And men suffer on the other end of it. How you doing, Dr. Brightman?
I'm well, thank you. How are you?
That's probably the most interesting. Dr. Rebecca Brightman is with us, but that's probably an interesting way of introducing you, isn't it?
In terms of men suffering as well?
Yes.
Yes, they do. They definitely do, because it's crazy to be around a woman who hasn't slept, who's been up all night with night sweats, and has hot flashes during the day. I think everybody loses out, unfortunately.
Well, you are and we just talked a little bit, but you're an assistant clinical professor of obstetrics, gynecology, reproductive sciences at the Icahn School of Medicine at Mount Sinai, and you are also a surgeon as well.
I am. Yes, I am.
Okay. Hot flashes. Tell us a little bit about that, and then a little bit about what HRT can do with this.
Sure. So hot flashes are a sensation that women get, and this can start, up to 7 years before they have their final menstrual period. Mm-hmm. But it's a sensation of intense warmth that typically starts in the chest and then radiates towards a woman's face. A woman gets very flushed feeling, can start to break out with a sweat. It can last a minute or two. It's frequently followed by a period of almost shivering or feeling cold, because a woman actually subsequently can drop her core body temperature a little bit because she's sweated in response to having a tough time regulating her own body temperature. So hot flashes and night sweats start to occur, as I said before, about 7 years before a final period. And in the past, we were very limited in terms of how we could treat women and the options we could provide them with. And hormone replacement was always considered an option, although in 2002 it received all sorts of, negative publicity because of the WHI study, and many doctors and patients decided, let's stop hormone replacement, and the search began or continued for alternative ways of treating women. And while there are plenty of women who do well on hormone replacement, and I do put them on hormone replacement, there is, great room and interest, and the good news is there are some wonderful options for treating women who are suffering with hot flashes and night sweats.
Now, before we get into some of the treatment and some of this new drugs that are out there, which are fantastic, hasn't some hormone replacement therapy, the HRTs, hasn't that been associated with some breast cancers?
Well, the thought is it may increase a woman's risk. It seems as though the earlier a woman is to having her final period, and also when used for the shortest duration of time, there is less likely an increased risk for breast cancer. And I think one thing, it's important not to, ignore the fact that 1 in 8 women in this country might get breast cancer during the course of their lifetime. And, who's to say it's because of hormone replacement or not? In general, it's certainly something I don't see in my practice, and I monitor my patients on hormones really carefully. So it's still, hormones are a great option for those people who are eligible.
Okay, so now let me double back in what you just said there, that the earlier they go through menopause and this change, the better off they will be as far as breast cancer. Their chances are lower?
No, the sooner they are to starting hormone replacement.
Oh, okay.
Meaning, as a rule of thumb, we don't like to start someone who went through menopause 10 years ago, because these women may be at greater risk of getting breast cancer. It seems as though it's safer when started very close to menopause. Safer in terms of putting women at less risk of cardiovascular disease, potentially stroke, potentially breast cancer. So the verdict is out. As a rule of thumb, when giving hormone replacement, we want to give the lowest dose for the shortest period of time to control symptoms.
We're talking with Dr. Rebecca Brightman, and there's this new drug called Relazin, correct?
Well, it's actually not a drug. It's hormonal. It's non-hormonal.
Okay.
It is natural.
Geico presents Strange Savings Stories. Sam Tucker woke to find crop circles in his cornfield that spelled out the word Geico. Was this a message sent by aliens? Sam went to Geico.com and saved hundreds of dollars with great discounts. He woke the next day to find new crop patterns had formed. They spelled out, "You the man." It seems the aliens were pleased indeed.
Geico. 15 minutes could save you 15% or more on car insurance.
The nights, sometimes several times in the middle of the night, their sleep is disrupted. They're disrupting the sleep of their partners. They're drenched. They need to change the sheets, their pajamas and whatnot. And then they, are grumpy and moody during the day. And then subsequently, and that can go on, during the course of, let's say a woman's 40s, for example. And then they frequently develop menstrual irregularities and some hot flashes. But it's really the hot flashes and the night sweats that are the biggest problems that I see amongst women of, that age group, that perimenopausal age group. And women want to be treated, and they want to explore their options, and they want to discuss, what are the best options for me? Is it something hormonal? Is it something that is a drug that's non-hormonal? Or is it something like a nutritional supplement, such as Relazin or other nutritional supplements that are out there?
Is there any indication that men also have a certain change and they can go through some of the night sweats as well?
Potentially they can.
Okay.
And I'm certainly not, I don't take care of male patients, but, for sure, as part of the aging process, men don't sleep as well either. And it's a known fact that as we all age, frequently we don't sleep quite as well, whether or not, we're disrupted because we need to get up and, go to the bathroom or there's something on our mind. So I think that there is something that goes along with that. And I think if a man is not sleeping quite as well and his, his female partner wakes up and she's sweating and she can't sleep and she's grumpy, I think can potentially impact the whole relationship.
Yeah, and women should not really get scared about this or fear about this because it's a normal process, but yet they do need to seek their healthcare provider. Correct?
Right. Well, it's a normal process. Not everybody, it's inevitable for all women, and not everyone is symptomatic. For some women, their menopause is totally uneventful, but by the same token, some women are really impacted, and women should discuss what's going on with. They should discuss their symptoms with their doctor, and it's an ongoing discussion. And I venture to say that it's during this transition, this is when I tend to speak to my patients the most.
Yeah, and we asked that ambulance to come by your office so that it gave this sense of realism to the interview.
Right. This is New York City.
That's right. So, well, it does. It kind of gives that sense of realism.
Right.
So what advice or what suggestions or words of encouragement, I guess we should say, that can you give to the people that are listening out there that are just saying, will these things ever end? I'm going through this process. It's like, oh, my goodness.
Yeah, so for most women, their symptoms can last, on the outside, usually it's a couple of years. Studies show some women can be symptomatic for up to 14 years. But that's not the norm. The good news, it's a natural process. There are great options to treat symptoms. And in addition, certain lifestyle modifications, making sure you eat well, making sure you have an ideal body weight, dressing appropriately, trying to deal with stress, whether or not it's through yoga or just decompressing before you go to bed. Keep the electronics out of the bedroom. Certain lifestyle things will absolutely help the symptoms. And again, it's a transitional period. Once a woman is on the other side and several years out from menopause, she returns to a new baseline. And the tumultuous sleep and the mood changes and all the other things that we associate with the menopausal transition really become quite minimal.
Should women fear the fact that they might lose their libido?
That's a real fear, and it's a real concern, and it's for many women, a biologic phenomenon. As women ovulate, and particularly mid-cycle, there's a surge in testosterone, which is, very convenient, and it evolutionarily makes a lot of sense that women have an increased libido at ovulation. So when women stop ovulating, testosterone levels also decrease. And the FDA has yet to approve the use of testosterone for treating decreased libido, but certainly many women do have decreased libido as they get older. And when they're sleep deprived and they're moody and they're not feeling well, it also really can impact libido.
Okay, we've got about another minute or two. Women also fear the fact that they're going to start growing facial hair and they don't want to shave.
It's true. And, that unfortunately, there can be a hereditary component. There's an aging component. The good news is there's some great solutions out there for women. Women can discuss it. Their OBGYNs may have some helpful hints, but also their dermatologists. But it's true. But I think it's important for women to remember that, menopause is normal. It doesn't mean they're losing their sexuality. It doesn't mean they're losing their beauty. These things can be maintained. Sometimes they need a little extra work. But I think it's important for women to exercise and have a healthy lifestyle in order to really feel their best.
There's something that I've learned, and that when you get older, sometimes it's not like you're gaining weight. You're just kind of getting thicker.
That's true. And, estrogen probably plays a role to some extent on weight, fat distribution, and women do get thicker in their midsection, and that's why it's really, really important after menopause for women to continue to exercise, if not ramp up the exercise, and really watch carbohydrate intake and calorie intake, because as metabolism slows down, that is where women tend to accumulate extra weight in their midsection.
It's Relazin.com, and then ESWOBGYN.com is your website, correct?
Correct. Yes.
Do you have a special thought for the day?
Do I have a special thought? Everyone should feel their best and have a healthy lifestyle, and I think, when you feel well, when you eat well, when you exercise, it all, comes back to, you can reap all the benefits of having a healthy lifestyle.
Well, Doc, I want to thank you so much for spending some time out of your day to talk with us today.
Thank you. Thanks so much for having me on the show.
You bet. Dr. Rebecca Brightman, and we want to thank her so much for being a part of the show. We'll be back.